And now we are going to have the presentation. May I introduce you, Natarajan, because everybody knows you. And we are so happy that we have, again, you know, our interaction with Aditya Jayat Hospital back in India. And you are free. Pode descompartilhar, Thiago, por gentileza? Natarajan, the screen is yours. And
okay.
I want to welcome you to our residents and fellows.
Yeah, so good evening, good morning to all the residents and fellows. Thanks for having me. Only thing is that during the outpatient, I will share my screen.
You just finished your operating room, Natarajan?
Operating, and then I had some 3 OPD.
Mm-hmm.
Okay, now you can see the screen.
Just a second, Natarajan, because you just came in. Let me put you to the co-hosting. Just, I'm sorry. Let me. I think you're already co-host, so you may share your screen, but it's not popping up yet. Yeah, it's okay.
So I'll show the screen. So this is the novel technique of external subretinal fluid drainage for exudative retinal detachment, secondary to Coats disease. So this is a 5-year-old girl with left eye Coats disease. They're presenting as a perception of light in left eye and 6 in the other eye. On examination, you can see the left fundus at present showing hard exudates and at the macula. She was initially managed with the scatter laser and injection Avastin. And during further, we presenting a minimally invasive technique where we use the indirect ophthalmoscope, place the needle with the viscous fluid extractor and an infusion line. So you can see I have placed a regular one infusion line. And because being a bullous exudative retinal detachment, we're using indirect ophthalmoscope, monitoring where we are placing the needle in the subretinal space, and then using the viscous fluid extractor, I'll be actually removing the fluid. So this is only to make sure the whatever fluid is removed, the eye not to have hypertony. So this is how the infusion line is placed. And you can see the reflex also is like a fully choroidal, a bullous retinal detachment is seen.
So, Natasha, you drained the subretinal fluid and okay.
Just going in the posteriorly with the needle, and then finally just inject the, and this was the post-operative picture where the vision was maintained, the retina was attached, and in the regular follow-up we look for any telangiectatic vessels, and if it is there, we have to give an antivascular growth factor injection, and if required, cryo or laser can be done. So the technique is, I think, very few people have, that's already published also, where you do a subretinal fluid drainage through the transscleral, transconjunctival, and in the bullous RD, where you place the needle in the subretinal space through the choroid, and then you have an infusion line which will fill the vitreous cavity, and then at conclusion make sure the intraocular pressure is maintained, and you can also give an anti-VEGF injection. And then once the retina is attached, you can do a laser.
All right, and this came to a good ending. And in the long run, did you follow that patient? The retina remains
like this. I have few patients who come for a long time. Even this was done recently, but we have patients who have been operated even a few years back. They maintain very well. I think, as I mentioned in the last slide, the idea is to prevent secondary glaucoma and even complicated cataract, so that at least the eye looks normal and it doesn't look for with the universal glaucoma, they have a problem. So at least you can save the eye. So we tell the parents the idea of the treatment is for saving the eyeball, not the vision. Usually they don't get much visual improvement.
Okay. And if you get the retina attached in the long run, of course, it's going to be better than having it detached and not treating. This is cool. Yeah. So we can follow with injections and other things as well. Great case. And I was waiting for you to show this case.
In the 90s, when I was with the Klaus Eckhart in Frankfurt, he used to do a 360-degree retinectomy, go behind, reattach the retina, remove all the exudates, but the results were similar. So I think the best is to reattach the retina, what Dr. Charles Keepan said, where your professor told in Retina Awesome, I forgot his name now, he mentioned about Dr. Charles Keepans and McNamara. So those people said, do the least to get the retina reattached. So I think this is the best. So you just, it looks a little cumbersome using indirect and putting the needle, and subconjunctival chemosis and those things happen, but that's on the table. But after that, the child is happy because generally the eye is quiet and because it's no suture required. And then you have an infusion line to make the intraocular pressure. Yeah, so I think this is the best treatment like I follow for Coats disease.
Yeah, it's interesting how we use the indirect, because I wouldn't have much difficulty on that because I usually see things inverted. So I'm used to that. But of course, we have to be careful in terms of sterilization and things. But it's very, it's amazing the way you can put the lens there and do the maneuvers. And awesome.
I have the lens also sterilized with the, we have a 80-word lens. And that's what I do for the sterile buckling also.
Okay, all right. Luciana, do you want to comment on Natarajan's case? Anybody?
Hi, Natarajan. Luciana from Goiânia. Congratulations for the case, Natarajan. Very nice.
Thank you, Luciana. Any questions?
Yes, don't be shy, residents. You may ask Natarajan. Henrique, I think Henrique is in the OR or operating room now, but anybody else? Alguém quer fazer uma perguntinha para o Natarajan? Alguém estão satisfeitos?
So you have to translate that I love all the residents in Portuguese.
Oh, yeah. O Natarajan, ele adora também falar com os residentes aí em português. Mas, you know, Natarajan, that to be allowed into the residency program here in Brazil, of course, everybody has to do this English test as well. So everybody pretty much speaks good English, but of course, many understand but do not speak so much, but everybody, I'm pretty sure, is understanding everything.
So,
I just want to thank you again for your participation, and also
I just wanted to Hudson, I just want to tell all the residents, we have a Portuguese ruling in India sometime, and then we have a 100-year-old Portuguese church in Bombay, and we also have what do you call I think there are some Goa is a replica of Sao Paulo. In the sense, we have that same white church. I forgot the name of the cathedral, which I saw it in Sao Paulo, which is there exactly in Goa also.
I know. It's. I think it's in the Praça da Sé. It's in the square. What it's called, Praça da Sé, the square there. I was there, and I took some pictures back 3 years ago when I was there on vacation with my son. And I know. But if you could get us some pictures, that is interesting. So we appreciate that.
Yes, yes. Shubha? Okay. So, I'll do that. I'll send it. Thank you, Hudson.
Thank you. My honor, Natarajan. Again, good to see you. Yes. You are finishing off your day, and we are starting ours. You know the time difference. And yes. Thank you very much for.
And I'm very excited to go to Greece, because with the Indian passport, we cannot travel anywhere. But the Greece ambassador is my friend. So he's got a special visa for me, special permission.
Yeah.
So I'm going on 28th to Greece. So
Oh,
I'll
really?
see you online.
Yeah, that's great. And
Yeah.
I'll be around, I'll be in France next November for that event over there. But, you know, we should, things will settle down and we are going to be together
The
pretty much
Brazilian,
soon.
and the Brazilian consul general is my patient, both husband and wife in
Oh, yeah?
Bombay. And her
In
sister,
Bombay?
her sister is an ophthalmologist in Brazil, who's known to Fabio Nogueira.
Oh, yeah, Fábio Nogueira, yeah. Good.
Yes, in Brasilia.
Congratulations, yeah, Brasilia. You know, I used to work here in my city, Goiânia, and Brasilia, which is 210 kilometers apart. So I'm there all week. Thank you again. Obrigado todo mundo. Thank you, everybody. And we want to thank Natarajan for participating. And you know, this program is possible because we have the interaction with our residents and Natarajan's residents and fellows as well. And it's an honor to be part of it. Thank you very much, everybody. Bye-bye, Natarajan.
Bye.
Bye-bye, Luciana, and
Bye.
everybody else.
Bye, Natarajan. Bye, Hudson. Bye, todo mundo.
Bye, Luciana. Yeah.
Eu gostei do bye todo mundo. Luciana. Um abração.